Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Privileged communication. Privileged communication are the statements made in good faith by the doctor about his patient to the concerned authorities without the consent of the patient. This is mainly done for the benefit of society or community or state. For the benefit of society, community, or the state, the doctor discloses the information of the patient to the concerned authorities. This is an exception to the rule of professional secrecy. For example, for society's benefit, persons suffering from venereal diseases, engine drivers suffering from uncontrolled hypertension and seizures, food handlers suffering from carrier of enteric fever, teachers suffering from tuberculosis, all these can be disclosed. For the benefit of the patient, suicidal tendencies can be disclosed to the parents or concerned authorities. For the benefit of third party, we can disclose some things like HIV positive status can be disclosed. In the court of law, in the court of law, the doctor cannot deny in the court of law when a question is asked pertaining to the patient. Any notifiable disease can also be disclosed to the concerned authority. If the patient has committed any crime, then this should be told to the police station or disclosed to the police or concerned authorities.
thank you and thank you for watching.